Hi everybody, thanks for joining us. We are broadcasting live from Children's Hospital and Medical Center, and today our focus is all about youth and teen sports, youth and teen athletes, and how to keep them safe and injury-free. Our expert today is Dr. Kody Moffatt. Thanks for joining us.
Thank you, Sarah.
He is the director of Children's Pediatric Sports Medicine Program. You're a national expert. I have to toot your own horn. I'm very, very active in this space nationwide and setting guidelines. So you've got a good expert here, and we're excited to get your knowledge and expertise today. I think first we want to invite you to ask your questions and put those in the space below, whether as we're live or later, and we'll respond to those. But I wanted to start, I think some people don't realize pediatric sports medicine is a thing, that it is a medical specialty because why? Why is it so important that we treat youth and teen athletes in a unique way?
Well, they are different, and kids are not small adults, and there's a huge difference between an 8-year-old and an 18-year-old, and the growth and development that happens during that decade of life is just tremendous. And it really takes a team of people who understand development and understand the needs of kids and teenagers in different sports and where they are kind of across that spectrum and competitive level to address their needs individually.
Mm-hmm. This time of year, what's your team seeing? What are the common injuries? What are the common issues and questions that you're getting from parents?
Well, now that the snow's finally melting, and things are clearing, and you can get people outside,
right.
Really soccer, baseball, and softball are really picking up. And early on, we tend to see more soccer injuries, and then the baseball and softball injuries tend to come a little bit later in the spring season.
And what are those kind of common injuries per sport that are the ones that you see regularly?
And for spring sports, soccer especially is a bit of a mix. Mm-hmm. Unfortunately, we still see quite a few concussions in soccer, and that usually comes from two people going up to head the same ball, mm-hmm. and often wind up heading each other, and one of them may or may not get the ball. Mm-hmm. But then the other part is a lot of lower extremity leg injuries, knee, ankle, hip, mm-hmm. Those types of things that can be both acute and overuse.
Mm-hmm. What about with baseball? You mentioned that later in the season.
Mm-hmm. Baseball, we see a lot of elbow and shoulder pain, and especially, again, talking about development, it's that 11 to 14-year-old where the growth plates are active, these young men are growing and growing quickly, and growing and throwing creates its own challenges. And there's extra stress that's applied, especially in pitchers, also in catchers, with to the shoulder and elbow with baseball.
I know some of this is sport specific, but for parents, what can a parent do to help prevent an injury out there on the field? What can they do to try to keep them safe in the first place?
I think the biggest thing is encouraging just the rules of the game and fair play, and trying to create an environment of just good sportsmanship and safety, because that's one of the things we're really trying to accomplish. Nobody's going to remember when somebody's 25 what their win-loss record was when they were 13. But you remember the fun and the memories and the friendships that you made with both the parents in the stands and the families and the kids with their teammates on the field. Mm-hmm.
And I'm glad you're starting to bring up those positive things, because I think it can be, you hear concussion and there can be risks, nobody wants their kid to get injured. But what's your advice for parents in kind of that cost-benefit analysis of injury versus getting to do what they love?
Yeah, and there is no kind of risk-free activity. We've seen young people get injured just doing simple, daily normal things at home. It doesn't have to be on the athletic field. We see it on the athletic field because that's what we do here as part of our team. Mm-hmm. But I've seen kids injured at home with an object fell off the wall and struck a young lady in the head. Wrestling around with their friends in the basement on a Friday night can cause young people to get hurt. Mm-hmm. But we do see it again in sports too, and that's the controllable part.
Mm-hmm. What do you see as the benefits? Because you're a sports guy. I know your kids did sports. For parents out there who maybe have a younger child or even older, what do you see as really the benefits of sports for children and teens?
Yeah, and I think it's important to look at the benefit. We can talk about risk all day long, But I mean, the reason I do what I do and my colleagues do what we do here at Children's really focuses on the benefits of sports. You know, in addition for young people being physically fit and physically active and staying busy, when we step back and we look at children's preteens and teenagers as they go through those developmental years, athletes compared to non-athletes tend to get better grades than their non-athletic peers. They tend to make better decisions when it comes to dating, alcohol, and drugs, for the most part, than their non-athletic peers. And you have the benefits of just teamwork, sportsmanship, learning how to win and lose with grace. Those are all really important life skills that I think athletics offers a really unique chance for young people to learn those skills.
It's good to have that balanced approach and remind people, because when you hear concussion, which is my next topic, you know, you are an expert on concussions. What is the latest research on that, and how frequently do you see concussions in your office?
Well, unfortunately, we see concussions nearly daily, but that's again what we do.
Right.
Probably the most important recent revelation in my world is recognizing what it does to the student. And all of my patients are students. Right. And things like Shakespeare and algebra are hard enough on a normal brain. And when the brain gets injured, schoolwork gets to be a lot more difficult. We try to get kids back into school as quickly as we can, ideally within a couple of days of the injury. We get young people back in the classroom, but just because they're back in the classroom, it may not be all day, and we may need to talk about working with schools and making the accommodations that'll help young people, you know, get through that recovery process.
But that's kind of a new approach, because it used to be like very different, right? What the best practice was for concussion management.
And part of that is research and what we've learned over the last few years. I really think we've learned more in the last 5 years than we've learned in the last 50. A concussion, what we know about concussions is just exploding and growing day by day. Even just 3 or 4 years ago, the thought was rest until you're completely better.
Lay in a dark room for a couple weeks or something.
Exactly. You know, no cell phone, it's in the dark, no stimulation, mom's sliding sandwiches underneath the door just to keep things going. But what we found is if you take a couple of days of just what we call relative rest, take it easy, lay around on the couch. Yes, they can be on their cell phone to communicate with their friends. The one thing about our teenage generation right now, that's the only way they communicate with each other, is electronically. And if you take somebody, a young person who already doesn't feel well, and then you completely remove them from their social circle, it doesn't take long before they become anxious and depressed, and you can actually slow down recovery. So I like to let them have their cell phone briefly, let them touch base with their friends. When they start to feel worse, put it down. Yeah.
You said the word recovery, and it made me think about physical therapy and just the recovery pieces we have in place here. Talk about children's sports physical therapy team and like how they come alongside what you do and the services that they offer young kids.
Our whole kind of rehab team, we've developed a real multidisciplinary program where we've got the physician side covered from non-surgeons such as myself, sports medicine surgeons. I've got a colleague who has the ability to do ultrasound guided injections if we need to. And then on the rehab side, we've got some very skilled physical therapists who address those kind of developmental issues, again, and develop rehab programs that are appropriate for the 8-year-old versus the 12-year-old versus the 18-year-old, and geared towards their specific goals, because that's important. And the physical therapy facility is
really cool.
It's cool.
It's really cool. We'll actually put some photos in the comments below. We can post those because it's stunning.
They've got some fun.
It's fun.
They've got fun toys.
Yeah, exactly. It looks like a fun place to rehab. If you've got a rehab, it's a good place to do it. And then relatively new, what's happening with your team in Lincoln? Because obviously we've got young athletes statewide that need services. So
well, and we've tried to expand geographically, where we've got our main campus here at Children's, and then our sports physical therapy facility out in basically West Omaha.
Right.
And then in Lincoln, We're expanding physician and athletic training services with my new partner, Dr. Natalie Ronshagen, who just has been a really strong addition to our group, and we're excited to have her on board. So we're providing surgical and non-surgical services through Children's in the Lincoln area too.
Yeah, we always want to share that, because whenever you can make it more convenient for families, closer to where they live, it's a good thing.
Well, and we're finding this for Western Nebraska too.
Sure.
I mean, here at Children's, we have the unique set of expertise, and we have families that travel from Central and Western Nebraska to come in and see us, and if we can cut an hour off their drive to come in and to get the level of expertise that we have, I think it helps families.
Absolutely. So help us spread the word on that. What is the number one question these days? What's trending when you have patient families come in and see you with their young or teenage athlete?
Two issues. One is with the really serious injuries. Both the kids and teenagers, and especially the parents, they just want to know, is my child going to be okay? And almost always the answer is going to be yes. We're going to have to do some things to get them back, but really the fun part of my job is, for the most part, I have normal, healthy young people who get sick or hurt, and we find a path to get them back to being normal and healthy again and doing everything that they want to do. It's really unusual that we wind up having to restrict people and cut them off from the activities that they like. And the other question we get a lot kind of surrounds that kind of sports specialization.
Okay, for people who don't know that term, or early sports specialization, kind of what does that mean, and then what do you advise on that topic?
And it's kind of been a slow generational shift, if you will. And we see it across the board in multiple sports where young people get involved and they demonstrate early on a skill higher than most of their peers. They love it, and then all of a sudden, before you know it, your whole life, and often the family's whole life, surrounds the young person's activities, whether you're traveling or not. Often travel's involved too. And there can be some real positives in that. I did travel sports with my kids too, and
you're like, I get it.
Yep.
Yeah.
And with my family, we tried to keep a balance, and I think in the end we kept a good balance. But it is a battle, and a balance to keep it that way. But kind of the important thing to remember is, if you look at athletes long term, the young people who specialize early often burn out early and quit doing their one early on dedicated sport, and then often quit doing sports entirely. And then we lose the benefits that we were talking about earlier. And when we look at especially collegiate athletes who are on NCAA scholarship or playing at the professional level, most of them were multi-sport athletes through high school. And specializing early on does not necessarily get you to where you think you might end up in the long run.
Is that sometimes a hard message to deliver?
It is. And again, but it's real. And it's something that we see.
All you can do is share your best advice. Yeah. You kind of alluded to how competitive things are. I know I have a little one, and I'm already like, there's so many levels and ways to do this, youth sports thing. What are your recommendations for the whole family on how to keep that in balance? You had mentioned that your family faced that.
And again, you need to include every child and make things practical for the family. Cost certainly has to be a consideration. And the time. And managing school first. They're all student athletes, and grades and academics have to come first, but then the athletics build on that, and again, getting the physical activity and the socialization and the teamwork, again, all those important skills.
Sometimes in TV shows and movies, we have that stereotype of like parents screaming from the stands at their child or their young athlete. On that front, what advice do you have for parents on how to guide and how to support in this realm of sports? Just generally through the ages and stages, how to best support your young or teenage athlete?
Probably the two biggest things, no matter what you're thinking and feeling on the inside, keep your comments positive, especially about somebody else's child. And when directed towards the officials, even if you're convinced the officiating is horrible, don't comment on it, because all it really does is undermine the game. So keeping that part of things positive is important.
And you have another one that you didn't mention, but you said to me a while back, don't coach.
Oh, don't coach from the car.
Don't coach from the car.
So on the way to practices and games and on the way back, leave the coaching to coaches. And I think it makes the family, and it certainly makes the child or teenager a lot more relaxed if they're not getting prepped by their parent on the drive there and debriefed on the drive back.
Yeah, that's really good advice. Very practical. Thank you. So what's your background with sports? How did you get into pediatric sports medicine?
I finished school as an athletic trainer and worked for almost a decade as an athletic trainer. I was in a few different settings and finished in professional hockey for a while. Loved it. Loved the travel. Met my wife and decided the travel was not going to work out, and kind of rethought my career. Went to medical school a little bit later in life and went into pediatrics, and now through Children's we've been able to combine my prior career in sports medicine and my prior background in pediatrics, and have really, it's been fun, but they've allowed us to build a pediatric sports medicine program. And the exciting part is it's not just Kody Moffatt in a clinic.
Yeah.
I've got athletic trainers, physical therapists, speech pathologists who really help us with concussions and getting young people back in the classroom and that whole return to learn process. We get to work with colleagues in cardiology and nutrition and psychology, optometry, and there's a lot to sports medicine. And the nice thing here is we've got a multidisciplinary team and a good skill set and kind of a coordinated effort to do our best to take care of young people.
This is kind of backtracking from where I was going, because I was kind of asking more personal questions. But, you'd mentioned soccer and we mentioned baseball this time of year. But I know we've talked about, there are some other sports that might not be kind of the first ones people think of that bring a lot of people to your clinic too. What are some other sports that people might not think of injuries with that you treat young athletes from?
One growing sport, lacrosse.
Okay.
And it's exciting, and people get injured, boys and girls.
What are the injuries?
Usually not too seriously. Either ankle or knee injuries or impact from a ball or a stick.
Okay. That would do it.
Yeah.
That would do it.
Less commonly concussions.
And I was kind of thinking of traditionally some of the more dance, cheerleading you've mentioned too. I mean, you see quite a, those are, your daughter, wasn't she a dancer?
She
I mean,
was.
those are serious competitive sports as well. What do you see from those disciplines?
There's a whole unique subset of sports medicine that is dance medicine, and
That's fascinating.
It's really interesting and exciting. The mechanics are different, and being able to understand the mechanics, the demands, the need for dancers, and dance is athletics. I mean, these mostly young ladies are working out several hours a week, to the equivalent of it being a part-time job, and it's usually overuse injuries, not acute. But the kind of the fun part for me is figuring out the anatomy and the mechanics of how they're moving and how that's playing into their injury, because you need to correct that to be able to make the problem better.
So what is the most rewarding part of your job? And I don't know if there are any anecdotes that you can, hey, I saw this kid who he didn't think he'd ever been able to return. I imagine that's the stuff, kind of the before and the after. But you tell me, what do you love about coming to work?
It's kind of day in and day out getting young people back to being able to do the things they like to do, either functionally well or often without pain. Because it's usually pain that's keeping them from doing what they want to do. And if we can correct what's driving their pain, again, they can get back to the athletics and the activities that they love.
Mm-hmm. That's what it's all about, the happier and healthier kids. So it's a really, really interesting team approach we have and a field. It seems like this is a really growing rapidly, this area of medicine. Is that true?
It is, and it's not just a model that we're creating. I've got colleagues across the country, and medicine's a social profession, so doctors are kind of boring people by nature. We sit down at meetings and
you said it, not me.
It's true. But we sit down at meetings and we talk about, what has worked in Omaha, Nebraska compared to what has worked in other parts of the country, and we learn from each other's successes and failures, and almost everything we're doing here has been tried somewhere else in the country, and I'm building off my colleagues' successes.
Yeah, well, it's collaborative and it's all for the best of the kids. So we are glad to have this opportunity to share some of this exciting field with you and about our team, not only in Omaha but in Lincoln too now. So
Absolutely.
Thank you for sharing your time and your expertise. We hope everybody has a safe spring sports season out there. Thanks for joining us. You can also follow us, of course, on Instagram and Twitter. And if you want to learn more about Children's Pediatric Sports Medicine Program, you can visit children'somaha.org.